13 cents better than the street had expected.
One of a handful of doctors in Congress is making a House call in his district today to talk about health care reform. Congressman Michael Burgess is set to sit down with North Texans on the topic, which is obviously a hot button around the country. Joining us with the preview, though, to begin with, is the congressman, a member of the Energy and Commerce Committee and chairman of the Health Care Caucus. Congressman, good to have you with us this morning.
Good morning.
So
good to be with you.
Even after all the town halls we've seen over the past week, you're still willing to do this. How much work can be done, or have these things just become circuses?
Oh no, this is a valuable time that the country is spending. You know, bear in mind, I'll credit the Democrats with slowing down the Democrats' plan. Obviously, the Republicans don't have the numbers or the organization to effectively stop anything that the Speaker of the House wants to push through. This bill was revealed to us on about July 15th. We were supposed to deal with it over the next 2 weeks and then vote on it before going home for the August recess. As you know, that didn't happen, and it gave Americans a chance to look at this bill, and they did. And now they're reporting back to us with their grade sheets. And to tell you the truth, almost all on both sides of the political spectrum are turning in an unsatisfied report on this bill.
Do you think Americans know exactly what they're grading? Or, I mean, when you got something going on in Senate Finance, you got your bill, you have no idea. The president has not made clear what he insists on getting to his desk. How are Americans supposed to know what to argue for or against?
And first, a brief correction. It's not my bill, but the bill that's on the House side.
I'm sorry, I mean the House bill, yes.
Correct. And you make a valid point. The president is the one who has the political capital to spend. Certainly members of the House and members of the Senate have approval ratings that are in the single digit. The president still enjoys a widespread popularity across the country, and he's the one who should be speaking on this. This past week he has been, and I don't know that he's been entirely effective. But here's the deal. People are so concerned that the government has taken over such a large section of the manufacturing in this country, the financial sector, and now it's going to take over their doctor's office, and people are understandably concerned, and some, quite frankly, feel betrayed by their government.
Yeah, big government is one fear. Another fear is having 14,000 people lose their insurance a day, right? Are being denied because of pre-existing conditions. Isn't there an argument that with every day more people being added to the rolls without insurance, that eventually those are numbers that are by nature, you would think, going to side with some option, whether it's a co-op, whether it's a public plan, something that does not involve the hardened for-profit model we have in this country?
Well, let's be honest. Even a public plan is not a free plan, and it's going to cost something, and it's going to cost something in terms of dollars and cents, and it's going to cost something in terms of freedom. On the issue of the job losses, we would do far better for the American people if we would concentrate on that. Remember Bill Clinton when he said he was going to focus like a laser beam on the economy? Don't you think the American people wish we would do that right now rather than push our efforts off into 1,000 different ways? We could do so much if we were focused on job creation in this country, and instead we're not doing that. We're ignoring the coming crisis in commercial real estate. It's just not even on anyone's radar screen, and that's going to create additional job loss. That in turn leads to employer-sponsored insurance loss. There are things we could do. We could deal with the problems that people are having facing job losses and facing employer-sponsored insurance. We could improve the COBRA benefit. We could make that more streamlined and make it more suitable so people can continue their insurance. We could deal with pre-existing conditions, but we just won't. We won't because we want to push this big program through, and right now that's being done at the peril of the American people.
I agree with you that the number one priority should be creating jobs. But just focusing on the health care program, it seems that 70 to 80% of the American people are satisfied with the program they have. So why not allow the existing corporate programs that are in place to remain and just focus on the uninsured or the people who are losing their insurance?
That's exactly the argument that I have been making, that if we focused on the 8 to 10 million people who have a tough medical diagnosis, a so-called pre-existing condition, or they've been the victim of a rescission by their insurance company or their insurance company has dropped them after the fact, we could go a long way towards solving the crisis for the people who are being hurt the most. And, you know, the president says if you like what you have, you can keep it, except that's not really true in this bill that we had in the House.
Right.
You've pointed out that most Americans are, in fact, happy with the insurance that they have. And then the other thing the president says is the only thing that's not acceptable is the status quo. Well, wait a minute. You've got 60-70% of the people who are happy with the status quo. How can that no longer be acceptable?
Congressman, do you think is it overstating it to say that Democrats that are entrenched won't accept anything but a public plan, and Republicans that are entrenched wouldn't even accept a co-op?
That's so difficult to project right now because no one even knows what a co-op, how that's being defined. I mean, a purchasing co-op, sure, I'd be happy to look at that. I think there's a lot of things to recommend that, especially if you can purchase across state lines. I think there are places around the country where that model could work and work very effectively. It was encouraging to me to hear Senator Conrad say on Sunday that they don't have the votes for a public plan in the Senate and stop chasing that rabbit because it's not going to work.
But they're back chasing it again today.
Well, sometimes that's what we do. Do you believe the White House has truly backed off of the public plan? Or, I mean, they're protesting quite a bit about us making too much of what Secretary Sebelius said over the weekend.
Look, I'm a relative neophyte in Washington. I've only been there a few years, but one thing I have learned is nothing happens in Washington by accident. So when you have Tim Geithner, Lawrence Summers talk about a tax increase, and then they try to walk back from it the next day, get ready because they're thinking about a tax increase. When you hear Secretary Sebelius say maybe the public option is not something that has to be in there, these are concepts that they're putting out there for a reason, and they're gauging response to it. So the town hall then plays into that.
Right.
The one I'm having tonight in Flower Mound. Let me hear from the people who think the public option is the best way to go, but I also need to hear from people who agree with Secretary Sebelius that perhaps the public option should be taken off the table.
As a neophyte,
again, remember this public option is not free insurance. There will be a cost associated with it, a cost to the deficit and a cost to the individual as well.
Yep, CBO has projected that for sure. As a neophyte to D.C., does being there make you want to stay or get out as quickly as you can?
A valid question to ask, and I'll tell you right now, I feel like I'm exactly where I need to be. I didn't give up a 25-year medical career to come up here and sit on the sidelines. I want to be part of this debate. I welcome it. That's why I scheduled an additional town hall tonight. We had 2,000 people show up in Denton, Texas a little over a week ago for a Saturday morning town hall. My Denton town hall normally brings up 40, 50 folks. 2,000 people. I had to go out into the parking lot to hold the town hall because there were just too many folks who wanted to make eye contact with their member of Congress and let them know how they felt about it, whether it was agreed with me or disagreed with me. And then later that afternoon, we went up the road to Gainesville, Texas. We had over 500 people show up at the community college there for an additional town hall. People are feeling enormously betrayed by their government, and they want to let someone know how they feel. So this is an important part of the process.
But Congressman, as a doctor, do you think there is definitely something that needs to be done, and can we reach a middle ground? We had Congressman Weiner on yesterday who said he and 100 of his colleagues in the House will not vote for something that doesn't have a public plan, and we heard from Dick Armey yesterday who said, forget it, we don't even like the idea of co-ops. Is there a middle ground?
There is, and I alluded to it before. We could have fixed the problem with pre-existing conditions through insurance regulation before we came home for the August recess. That's the kind of activity the American people want to see us do. Now, remember, the health care bill as written on the House side was a closed process. I went to my chairman early in the year in January and said, look, I want to be part of the solution. He said, thanks for showing up, close the door, and I never heard from him again. At the same time, there are many of us who are anxious to work on this, sit down and work in a bipartisan fashion. And I even mentioned one of the Blue Dogs a couple of weeks ago. This is going to take the rank and file members of Congress working around their leadership to get done. I don't know quite how the trajectory is that you do that, but I will tell you, I don't think the leadership on the Democratic side, and quite frankly, my own leadership is not engaged on this as they should be.
Do you think that one of the reasons that they won't maybe take small steps and do things that are needed is in the back of their mind, the single payer is what a lot of people, they don't say it anymore. Barney Frank said it back in 2003. Are they dissembling? Are they not really saying what they're really headed for, Doctor?
if you're looking for a way to ensure political power for years to come, you'll take over the American healthcare system. I mean, it's one of the last bastions of freedom that is left in this country, and it's under continuous assault from all sides. Look, I'm a doctor. I don't want to give any more control over the private insurance companies, but I darn sure don't want to give any more over to the government. And to tell you the truth, in many